Chapter 33, Delivering Dental Care. Business assistant, clinical assistant, dental hygienist, and dentist must follow a specific routine, review the patient record, have knowledge of upcoming procedures, and have supplies and equipment ready. One of the best ways to know your patients and be better prepared for the day is to have a brief meeting or review of the day before your patients arrive. In this meeting, you'll discuss change in schedule or procedure, change in the patient's health that could alter dental treatment, additional supplies or equipments that may be needed, preparation for apprehensive patient, and assignment of expanded functions. Several sections of the patient record are viewed at each patient visit. Administrative staff should check for changes in personal information, such as address, phone number change. The clinical staff should check for health problems that may alter dental treatment, look for medical alerts, and review progress notes for planned treatment of the day. Treatment room should be clean, disinfectant, and ready for the next patient. Patient records, radiographs, and laboratory results should be in place. Sterile preset tray and other supplies in place. Dental chair positioned to seat the patient. Additional equipment moved out of the way for the patient and dental team. Pleasantly greet the patient by name in the reception area. Escort the patient to the treatment area. Place the patient's personal items in a safe place and out of the way of the procedure. Initiate conversation with the patient. Ask whether the patient has any questions about the treatment for the day that you might be able to answer. Team dentistry is also known as four-handed dentistry. Basic goals of this type of coordination is to use ergonomically correct dental equipment, use preset trays during dental procedures, minimize stress and fatigue during dental procedures, follow principles of motion economy during transfer of instruments and dental materials, use appropriate moisture control techniques, and delegate expanded functions of practice as legally defined within the state. The dentist and dental assistant should develop positioning habits that allow access to and visualization of all areas of the oral cavity. Whenever the dentist and assistant must stretch to reach for an instrument or gain access to an area of the mouth, stress is placed on the body. Accumulated strain contributes to lower back pain, circulatory problems, and muscle aches and pain. Once the patient has been escorted to the treatment area and seated, he or she is lowered to the supine position, asked to slide up in the chair until the top of the head is even with the top of the headrest, asked to turn his or her head to the right or to the left to allow easier access to a specific area of the mouth. The operator makes final adjustments to the chair to establish proper working distance. The correct distance should be approximately 12 to 14 inches. The operator should be seated as far back as possible, thighs parallel to the floor and knees slightly lower than the hips, feet flat on the floor, backrest of the chair positioned to support the lower portion or small, the back. The operator's forearm should be bent at the elbow and parallel to the floor. As the dental assistant, we should be seated well on the stool, feet on the base of the foot ring of the stool, positioned as close as possible to the dental chair, legs parallel to the patient's chair, and then your eye level should be 4 to 6 inches above the eye level of the operator. Classification of motions, 5 categories according to the extent of motion. 1, movement of fingers only. 2, movement of fingers and wrist. 3, movement of fingers, wrist, elbow. 4, use of the entire arm and shoulder. And 5 is use of the entire upper torso. Operating zones, basic concept required for the efficient, comfortable practice of team dentistry. We have the operator zone, transfer zone, assistant zone, and static zone. Instrument transfer is an ergonomically sound way to practice dentistry using the skills of the dental assistant while including work simplification techniques. The dentist relies on the clinical assistant to have the supplies, instruments, and dental materials ready to transfer into the dentist's hands. Requires coordination, communication, and practice between the dentist and dental assistant. Understand sequence of procedures and anticipate when instrument transfer is required. Transfer dental instruments to the and dental materials with the left hand. Transfer of instruments should be accomplished with a minimum of motion involving only fingers, wrist, and elbow. Instruments are transferred in their position of use. Instrument is transferred so the dentist can grasp the instrument for its appropriate use. An instrument being transferred must be positioned firmly in the dentist's hand. There are three basic grasps: the pen, the instrument is held in the same manner as a pen; palm grasp, the instrument is held securely in the palm of the hand; and palm thumb grasp, where the instrument is held in the palm of the hand and the thumb is used to stabilize and guide the instrument. The dental assistant uses a specific single-handed technique for efficiency. This applies to hand instruments, dental handpieces, and water air syringe. Variations in instrument transfer: mirror and explorer, cotton pliers, handpiece, and instrument with hinges. Expanded function dental assistant refers to specific intraoral procedures or part of a procedure performed by the clinical dental assistant that may be delegated by a dentist. Advantages include increased productivity, less stress on the dentist, more patients seen. Each time team member can focus on specific tasks and increase in job satisfaction. Dental supervision. Direct supervision: the dentist must be in the same treatment area as the APJA or the assistant to perform the function. Indirect supervision: the dentist must be in the dental office area, but not necessarily be present in the same treatment room as the APJA. As an operator, we will use operating position, lighting the oral cavity, developing near skills, using a fulcrum, knowledge of dental anatomy, understanding cavity preparations, adapting instrumentation, and applying dental instruments. Evaluation of expanded functions: you are accountable of your skills. You must attain the knowledge and skill needed for an expanded function through mastery of course material and also by talking with the dentist with whom you practice.